Did you know that over 7 million New Yorkers rely on Medicaid? But here's the scary part. Losing your physical card can literally freeze your access to essential medical care. Yeah, suddenly you've got no way to pick up that vital prescription or even see your doctor. Well, welcome to this explainer, where we're going to fix that problem for you right now. Okay, let's dive right into this. Look, losing your medical card is frankly incredibly stressful. Healthcare is the absolute last thing you want disrupted, right? But hey, don't panic. We are going to walk through the exact practical steps you need to take today to restore your access. Yes, even if you have a doctor's appointment or need a prescription filled as early as tomorrow morning. Here's our roadmap for this explainer. We're going to cover understanding Medicaid in New York, the reasons you might need a replacement, the exact steps to request one, what to do in urgent scenarios, some troubleshooting, and finally, maintenance and protection tips. All right, Section 1, Understanding Medicaid in New York. Let's establish exactly what we're dealing with here and why this little piece of plastic is an absolute lifeline for your healthcare. So in New York State, your Medicaid card is officially known as a CBIC, which stands for Common Benefit Identification Card. And without it, well, your doctors, hospitals, and pharmacies literally cannot seamlessly verify your active enrollment or bill the state for your visits. It's like a key that unlocks the whole system. Plus, keep in mind, every single member of your household enrolled in Medicaid actually has to hold and present their own separate physical card. It's totally individualized. Moving right along to Section 2, Reasons for needing a replacement. It's actually not just about losing the card. Okay, this is absolutely crucial, so listen closely. Before you request a new card for any reason, whether it was stolen, damaged, or maybe just has a typo in your name, you must update your address in the state system first. Why? Because New York enforces a super strict security policy to prevent fraud. Basically, all Medicaid mail is marked with a strict do not forward stamp. So if you've moved and just filed a standard change of address with the post office, they legally won't forward your new Medicaid card. Instead, it gets bounced right back to the state, and get this, that can actually trigger an automatic administrative review and potentially suspend your benefits entirely. Honestly, that's a nightmare you want to avoid. All right, Section 3, Steps to request a replacement card. Because New York doesn't just have one single magical replacement portal, you really have to navigate the exact pathway for how you originally enrolled. Now, this perfectly illustrates the 3 distinct administrative tracks. It's kind of like a massive highway with 3 different lanes, and if you get in the wrong one, you're looking at some major delays. State portals can't touch local county records, and city offices can't access state files. It's all very compartmentalized. So you definitely want to find your specific category here to make absolutely sure you're knocking on the right door. So if you fall into the New York State of Health Marketplace track, which, by the way, is mostly for low-income adults, families, and kids, you can actually handle this whole thing digitally. Just log into your verified account online, make sure you update your physical address first, and then hit the button to trigger a reissuance. Super easy. But if you're more of a phone person, you can just call their central center at 1-855-355-5777. Now, if you live in the 5 boroughs of New York City, the NYC Human Resources Administration track is going to be your fastest route. You can literally just use the Access HRA online portal or their mobile app. All you do is pop in your client identification number, your date of birth, and your social security number, and boom, you can request the card. Or if you'd rather, you can use their 24/7 automated Medicaid helpline at 1-888-692-6116. Okay, let's pivot over to the upstate track for folks living outside the 5 boroughs. Here's the catch. You actually cannot use those central state portals. Instead, you have to call your specific county's local Department of Social Services directly. So say you live in Juanita County, you'd have to call 315-798-5511. If you're in Broome County, it's 607-778-1100. You'll end up working one-on-one with a local caseworker to manually verify your identity and your address. Now, regardless of which of those 3 administrative tracks you fall into, your permanent plastic replacement card is going to arrive via standard mail in about 7 to 10 business days. But full transparency here, you should definitely be aware that processing hiccups or regional mailing issues can sometimes drag this window out to like 30 days. Which brings us to Section 4, Using Examples and Scenarios. Because what if you simply can't wait up to 30 days? This is a real game changer because, believe it or not, New York does not offer digital, printable cards online yet. If you have an urgent medical need, you basically have two lifelines. First, your doctor or pharmacist can actually verify your active status right over the phone using the eMedNY system. They just need your name, date of birth, and that client identification number. Or, option two, if your provider is a stickler and strictly requires physical proof, you're going to have to travel down to a local social services office with a government-issued photo ID. They'll issue you a temporary printed paper ID card right there on the spot. Now, what is really fascinating about that telephonic provider verification is how it actually works behind the scenes. It's almost like a secret code. Your doctor's office uses an alphanumeric conversion chart to translate the letters in your 9-character client identification number into a purely numeric code. So, for example, the letter A becomes 21 and Z becomes 12. This generates an 11-digit string of numbers that they use to query the system and verify your active status without ever needing to swipe a physical card. Pretty clever, right? All right, moving into Section 5, troubleshooting and FAQs. Let's talk about overcoming some common roadblocks. Honestly, the biggest hurdle people face is simply not knowing their 9-character client identification number, or SIN. And without it, you're completely blocked from using the automated phone menus or online portals. But don't worry, if you're locked out, you have 3 solid fallback methods. First, you can call the Medicaid helpline and speak to a real live agent. Second, you can shoot an email to medicaid.health.ny.gov. Just make sure you send it from the email address they already have on file for you. Or third, you can literally just dial 211 for local community navigation assistance. Whichever route you take, just be absolutely ready to verify your full legal name, your date of birth, and your social security number. Next up, Section 6, Maintenance and Protection Tips. How to keep that new car safe. Once you finally get your hands on that replacement card, you've got to protect it. This is especially vital in New York because a lot of households use this exact same physical piece of plastic as their EBT card for cash assistance and SNAP benefits. And since card skimming is, unfortunately, totally on the rise, the state recently introduced a really brilliant security feature through the EBT Edge portal. You can now securely freeze your card using their app when you're not actively using it. And here is the absolute best part. While freezing it instantly blocks all financial transactions at the register to stop scammers, it does not block your medical providers. Your medical billing remains 100% active, even when the card is completely frozen financially. How cool is that? Almost done. Section 7, Conclusion. Let's do a quick recap. I'd highly recommend keeping this explainer handy. Remember the golden rules here. Absolutely update your address first so you don't accidentally trigger a case suspension. Then make sure you identify your correct administrative track, whether that's state, city, or county, so you can avoid those agonizing delays. And never forget, if you have a true medical emergency, you can always go into an office to request a temporary paper ID locally. It's a real lifesaver. And hey, please share this explainer with anyone in your community who might be feeling a bit overwhelmed by this whole bureaucratic maze. We're all in this together. Finally, Section 8, Disclaimer. Just an important note to wrap things up.
Look, government policies, procedures, and even phone numbers can and do shift over time. So always make sure to verify these current details with official state resources like the New York State Department of Health. But before we go, I want to leave you with this final, kind of provocative thought. Seeing just how complex this whole replacement web is, how much easier would our entire healthcare system be if secure, downloadable digital ID cards were just a standard reality for everyone? Makes you think, right? Thanks so much for learning with me today.